Everything can start with a simple abdominal pain and end in emergency surgery just a few hours later. And after an appendectomy, the first hours of nursing care can make the difference between a stable recovery or a serious complication. Welcome to Healing Hands Nursing. In this video, we will clearly and thoroughly explore nursing care for patients undergoing an appendectomy. Let's begin with the basics. What is an appendectomy? An appendectomy is the surgical removal of an inflamed appendix. The greatest concern occurs when the appendix ruptures. When this happens, bacteria and intestinal contents can spread into the abdominal cavity and lead to peritonitis, a potentially life-threatening emergency. That is why early recognition and timely intervention are so important.
The most common causes of appendicitis can be understood with two key concepts: obstruction and infection. The appendix may become blocked by fecaliths or by swollen lymphatic tissue during an infection. Once blocked, bacteria become trapped inside and begin to multiply. That increasing pressure and inflammation can eventually progress to perforation if treatment is delayed. The main difference between emergency and non-emergency appendectomy cases is urgency. In emergency situations, surgery is performed immediately because the risk of rupture is high or the patient's condition is rapidly worsening. Severe abdominal pain, fever, vomiting, and signs of systemic deterioration may all indicate the need for urgent intervention. In some non-emergent cases, the patient may initially stabilize with antibiotics before surgery is scheduled later. However, many patients still undergo appendectomy to prevent recurrence and future complications.
There are two main surgical approaches for an appendectomy: laparoscopic surgery and open surgery. Laparoscopic surgery is a minimally invasive approach performed through several small incisions. A camera and specialized instruments are used to locate and remove the appendix. Because the incisions are smaller, this approach is often associated with less post-operative discomfort, shorter hospital stays, and faster recovery. Open surgery requires a larger abdominal incision. This approach may be necessary when the appendix has ruptured, when there is significant infection or inflammation, or when the surgeon needs better access to the abdominal cavity. For nursing staff, identifying the surgical approach is important because it helps anticipate the patient's pain level, wound care needs, mobility tolerance, and expected recovery progression. Before surgery, nursing care focuses on patient safety, preparation, and early recognition of clinical worsening. The nurse should assess and monitor pain characteristics, nausea or vomiting, temperature, heart rate, blood pressure, oxygen saturation, and any signs of deterioration. NPO status must be confirmed. Allergies, medical history, and current medications should be reviewed carefully. IV access may be needed for fluids, medications, and ordered antibiotics. Nursing staff may also assist with preparation for diagnostic studies, such as ultrasound or CT scan, according to facility protocol. And equally important, emotional support. A calm, clear explanation can reduce anxiety, improve cooperation, and help the patient feel more prepared before surgery. Many times, recovery does not depend only on the surgery itself, but on what happens during the hours that follow. First, monitoring. Post-operative assessment includes vital signs, oxygen saturation, temperature, pain level, response to analgesics, nausea or vomiting, oral intake tolerance, and evaluation of the dressing and surgical site. Second, pain management. Analgesics are administered according to provider orders. Pain is reassessed after intervention, and patients may also be educated on simple supportive techniques, such as repositioning, controlled breathing, and splinting with a pillow when coughing. Third, respiratory care and complication prevention. Deep breathing exercises, effective coughing, and use of the incentive spirometer may help reduce the risk of atelectasis and pneumonia. Early ambulation is also essential for preventing pulmonary complications and thrombus formation.
Before discharge, education should remain simple, clear, and easy to verify. Patients should understand how to care for the surgical site, including keeping the incision clean and dry and following instructions provided by the surgical team. Warning signs must also be reviewed carefully. Fever, worsening pain, increased redness, purulent drainage, persistent vomiting, shortness of breath, or any significant clinical deterioration. Activity instructions usually include daily walking, while avoiding heavy lifting or strenuous activity for the recommended period. Diet progression should follow tolerance and provider recommendations. Medication education should include dosage, timing, possible side effects, and safety precautions. And finally, follow-up appointments should be reinforced. The teach-back method can also help confirm understanding by asking the patient to explain the discharge instructions in their own words. In summary, appendectomy is a common surgical procedure, but post-operative nursing care and discharge education are where nursing truly protects the patient. Monitor carefully, manage pain effectively, encourage early mobilization, prevent respiratory complications, and reinforce warning signs before discharge. Thank you for watching Healing Hands Nursing. If this type of content was helpful, like the video, subscribe, and turn on notifications for more real-world nursing content, post-operative care, and clinical situations seen every day in med-surg nursing.